Having a good understanding of the sex or gender disaggregation or distribution of COVID-19 can help policymakers understand things like risk communication, because it's possible that drivers of the differential impacts of COVID-19 are biological. Then it can actually inform the risk communication so that it's clear which sex or gender is more affected, and then people can take the right precautions. But it could also give an indication of what kind of societal impacts to expect, and therefore support the design of interventions, not just for prevention, but for mitigating the impacts in the wider society.
I think the tracker has the potential to have an impact in two directions, or on two different issues. The first issue is to encourage better reporting from the countries that are currently not, on the surveillance systems that are currently not reporting sex disaggregated data. Hopefully the tracker acts as a sort of positive reinforcement to persuade countries to release sex disaggregated data. But I think that it will also potentially have an impact on a more tailored and effective and equitable treatment and prevention interventions.
COVID really reflects what we see across the sector, doesn't it? That for some reason health planners tend to be gender blind. And we're hoping that a number of organizations have picked up our data and are republishing it. And we hope that in the context of the World Health Organization review of the international health regulations, that moving forward in the next iteration of those regulations, we'd see a call on countries to report data that was sex disaggregated, and we'd also see a call on WHO to collect, collate, and publish that data.
I'm very happy that we have undertaken this particular journey. I urge all of you to please urge to your governments to gather data from a gender lens and make that public, so as to use that data to inform programs that are useful and would mitigate the impact on those who are most impacted by the pandemic, the hard to reach population and hard to reach women.